Welcome to the last breakfast. Please enjoy the video.
You start by confirming the kit contents and your privacy. Once done, wash your hands thoroughly and open the cleanser. Uncap carefully to avoid spills. Apply a small amount to a wipe or to the applicator as instructed, because controlled application prevents irritation. Make sure to use the glove if included. It keeps contact hygienic. If you're trying this for the first time, test a tiny bit on your inner wrist and wait a minute to check for sensitivity. Now you perform the core cleaning routine. Gently apply the cleanser using a front-to-back motion to minimize bacterial transfer. Move slowly and use light pressure. Vigorous scrubbing can disrupt natural flora. If your applicator is reusable, rinse it with warm water between passes and pat dry on a clean towel. Make sure to rinse residual cleanser thoroughly with lukewarm water, because leftover product can cause dryness. If you notice burning, sharp discomfort, or unusual discharge, pause and reassess. To finish, gently pat the area dry with a clean towel. Avoid rubbing and skip scented powders or sprays which can irritate. Once dry, apply any recommended soothing product from the kit sparingly. Make sure the lid is secure and store the kit sealed in a cool, dry spot. Replace single-use items after each session. If irritation or persistent burning appears, stop use immediately and consult your healthcare provider. Additionally, use the included pH strip to check if the balance is outside the expected.
Thanks for watching. If this was helpful, leave a like and consider subscribing. See you next time.